it connected? All right. Okay, everybody. Well, welcome to our workshop on P EMF therapy. For those of you who have not met me yet, my name is Megan. I'm pretty new here at Natural Health Practices. I just moved down from Ohio in July with my husband. So he's attending chiropractic school, and I, up in Ohio, was working at an office very similar to this with a chiropractor and nutrition response testing, and I had the P EMF machine there, was a practitioner there, and loved it. And so when we found out we were relocating to Fort Orange, I thought, oh, there's not going to be anyone down there. And lo and behold, Dr. Shelley was here in this fabulous office. And so I found a place here, and it has just been wonderful. And so I brought my machine with me, and I'm very excited to kind of talk to you about that. Before we dive into like what P EMF therapy is, I just want to give you a really short background on what my history is with my health issues and as a practitioner. So that way you have a better idea of why I'm so passionate about not only working in an office that offers chiropractic and nutrition response testing, but also why I get so excited about P EMF therapy. So I was born with a genetic immune deficiency. It's called common variable immunodeficiency disease with IgG2 subclass deficiency. Super exciting name, and it was about that exciting to be diagnosed with it. So I had kind of a difficult childhood, was always sick. The diagnosis basically meant that I only had 50% of an immune system. So they said, you know, oh, you'll be really lucky, you know, if you live to your late 20s because your immune system is shot. Like most people don't live that long because you're constantly bombarded with like germs, and I had no immune system to do that. So like as a kid, like if they would vaccinate me, 30 days later you could test me and it would show nothing. So I couldn't hold any kind of resistance to any kind of like bacteria or germs that I was interacting with. So my parents were wonderful, and of course we were going to the best doctors, and as a young kid I was on a ton of medications. I was doing pretty intensive therapies, including like plasma infusions, basically doing almost like a blood transfusion every week to try to like keep my immune system functional. So it was a little bit rough, and so I obviously had a lot of side effects from that, and was on narcotics and muscle relaxers and migraine meds and everything you can imagine. My digestion was a disaster, and so my mom really tried to emphasize like natural and holistic living as much as we could, but we also were trying to work with Western medicine. So by the time that I was about 12 or 13, she really started to feel like, oh my gosh, like you're, you know, on really heavy narcotics and taking all these medications, like this is kind of crazy. So she said, let's kind of just branch out. Let's just see if there are other options. Like there's no pressure. If they don't work, it's no big deal. So we traveled around and tried every kind of practitioner. We found some relief with some things, but nothing substantial. So in high school, we had a family friend who recommended that we go see a chiropractor who did nutrition response testing. So we had been to so many people, so I was like, okay, whatever, I'll go with you, but like this isn't gonna work, nothing works. So we get up there, and both my mom and I commit to doing like a program with them, and within 3 or 4 months, almost all my food allergies have gotten a lot better. I'm off on my acid reflux meds, I've stopped the muscle relaxers. We just kind of keep baby stepping. A couple months later, I'm off of my narcotics. A couple months later, I'm off of this. So we just kept working our way to eventually I stopped doing all my plasma infusions. I totally stopped doing any of like my immune boosting drugs or immune suppressants. And I am now several years of being totally like medication free, which is so crazy. And I'm 29, so I made it this far, right? And I feel like I'm doing pretty good. I will actually go back and do blood tests just to like see what it looks like. And I've had several physicians tell me basically that, oh, we misdiagnosed you. Like, oh, as a kid, I'm sorry, I get a little emotional talking about it because it's just so crazy. Like growing up with that and just always having it in my mind and like knowing in my body that things weren't right, and then getting to a point where I feel great, like I feel so successful. So nutrition response testing was a huge part of that for me, and chiropractic care and just eating really well and living a very like natural lifestyle is essential. One thing that we could not get under control though were my migraines. We tried everything, and probably because I did so many years of plasma infusion, so I had other people's bodily fluids in my body. So no doubt my body was rejecting that to some extent and causing all sorts of side effects. So I was having a lot of migraines and fibromyalgia pain. Those are the two things that we just like could not get under control. So for years, I was like, you know what, it's okay, I'll take it, because we've made so much progress, it's not that big of a deal. And then I met my husband, and he's really crazy into holistic stuff as well. So he was doing a ton of research and sending me to all sorts of different therapies. And about a year and a half ago, he said, why don't we go and try this thing? It's called a P EMF machine. And I thought, okay, sure, like, why not? We've tried all these other things. So we drove a couple hours, and this gentleman had this same machine here, the chair, in this machine. So I sat down, and he did a full body treatment and then also worked on my head. It was an hour long. I did that 2 days in a row, and then we went home. Well, I didn't have a migraine for 6 weeks, and my fibromyalgia pain was better, and my stomach felt great, and I slept really good. And at first, I didn't say anything to my husband because I didn't want him to know he was right? We didn't want to give that away. But after about 5 days, 6 days, I was like, listen, I feel really good, and I feel like my head feels super great. So he said, okay, great, let's buy one. And I was like, oh my gosh, please, I don't know about this. But we were both working in holistic offices at that time, so we knew that not only could we benefit my health, but we could benefit the other patients coming in potentially. So we did our research and we made the investment. So we bought this awesome machine, and we've just had great success with it, including myself. My head, I cannot even tell you how great my migraines are. I can feel them coming on, and if I get an adjustment now, they're gone. It's not like they used to last for days and even weeks at a time. So that's kind of my very brief synopsis of how I came to be in this field and why I get very excited about the P EMF therapy. And you're gonna have to forgive me, I'm parched because I've been walking around all day. Okay, so now that you know that I've had great results from it, I kind of want to go into what P EMF therapy actually is. So it stands for Pulsed Electromagnetic Fields Therapy. And I know it sounds like a very long and fancy name, but basically what it means is that it's an electrical magnetic treatment for the body. And so a lot of times people, when I'm showing them the machine or we're talking about the therapy, they kind of think it's a very new age kind of thing. Oh, that's kind of fancy, that doesn't, it sounds natural, but is it really that natural? But here's the thing, most of us don't realize that we are surrounded by pulsed electromagnetic fields every single day. So we hear a lot about EMS coming from cell phones and Wi-Fi and all of these things, but we don't hear so much about natural PEMFs. So pulsed electromagnetic fields do occur in nature. They are in everything. So the earth actually emits a pulsed electromagnetic field every second of every day. And I know this doesn't mean anything to you, but the number that it emits is a 7.8. I can actually replicate that frequency on this machine, which is so cool because it's such a healing and relaxing frequency. And the way I think about this as the Earth's frequency is almost like it's the Earth's heartbeat, right? So it's kind of pulsating all the time. And the way that the Earth gets its charge is through lightning bolts. So I don't know if you know this, but every single day, there are between 8 and 10 million lightning strikes that hit the Earth every day, all day long, which is so crazy. Yeah, she says right here, because we get a lot of thunderstorms, which is so true. So I think that that's crazy because lightning is high voltage, but the way that the Earth absorbs it, it uses it as a low voltage. So it takes in the high voltage from the lightning strike and emits it as this very healing low voltage. The crazy thing too is that without lightning, the Earth could not sustain life. Without lightning, the Earth could not sustain life. I don't know about you, I've taken a lot of science classes in my life. Never once did that ever come up. I have no idea that we need lightning to be striking the Earth for it to actually be sustainable for us to live here and for animals to live here. So that's super important. I want you to take that away from this class because it's not just about this cool, crazy technology. It has more to do with the foundation of life. God designed this world so beautifully and so intricately, and that includes every little detail, including things like lightning strikes, which I think is so fascinating. So what does this have to do with your body? We are all electromagnetic beings, so we all emit a frequency as well. Every cell, every organ, every animal, every plant is emitting some form of a frequency at different times of the day, depending on what they're doing, but we all have a frequency to us. So I like to think that a lot of people will call like the nervous system the electrical system, because a lot of times that is kind of what keeps us charged and helps like emit that frequency, but actually each cell in the body has a frequency as well, which is so great. So the problem is that we're constantly bombarded with burdens on our system, right? We're exposed to toxins, pollution, we have, water that has things in it, we're not eating very well, we're, never really outside or in the sun, we're not, we're not exposed to or given opportunity, right, to have like perfectly healthy lives. Like that's just how it works. But over time, with everything that we do and that we eat and that we put into our bodies and expose our bodies to, it reduces our electrical charge. So a lot of times, it basically like impedes the ability for your nervous system to send signals for your body to be able to heal, if that makes sense. So a lot of times I think people don't think about this. Like they're thinking a lot about like, oh, it's okay, like I just hurt myself or it's just this, but really like if you hurt yourself, your body should be able to heal it. And that's how we're designed. It's amazing and it's so great. And to be able to do that, you need proper nutrition, you need good hydration, you need mineral balance, but you also need an electrical frequency. And if that's been depleted from our lifestyles, just like we encourage you to eat well and to seek out like a nutrition response testing practitioner like Dr. Shelley or Kim, we also sometimes need that little boost of like an outside source of energy to kind of re-stimulate the body and the cells. So I wrote this little quote down because I think it's really good. Albert Einstein once said that we cannot solve our problems with the same thinking we used when we created them. And I think that's really important, and I think that says a lot about you guys for being here today, because you all know from being here and from being exposed to everyone in this office that it takes work and it takes a change to get the results that you want. Like you can't just keep doing the same thing over and over again. If you're sick and you're having issues, it's not going to change if you're not making changes. And so I think that that's really important and applicable to PEMF therapy because, sorry, I have so many notes, guys. Okay, so our cells function like capacitors. So just like I said before, right, all of our cells have an electrical charge. So they actually accumulate and hold that charge just like, almost like a cell phone battery, right? That's how I like to explain it to people. It's a good visualization. And the voltage or the charge begins to drop and pain and disease and dysfunction begin to manifest. And they can manifest in so many different ways, as you know, like really any pain or ache or issue that's happening, for you, it might be your knee really hurts, and for you, it's your digestion. So it can manifest within the body in so many different ways. And like I said before, to recharge the cells, you need proper nutrition, hydration, mineral balance, and energy. So the cool thing is that, sorry, getting lost here. Okay, so when we think about like the nutrition aspect, so you come in, let's say, I know some of you are patients with Dr. Shelley or Kim, so let's say you are home before you ever came in here and you're maybe at 10%. You're really just hurting and your body is struggling, so you come in and you see Dr. Shelley, you get on a nutrition and chiropractic program, and within a couple of months, we've got you at 70%, 75%, which that's phenomenal. You've made huge progress. Your body is doing great. You're on the right track. The problem is that sometimes you just need that little extra push. You need an outside source of energy to kind of help get you past that. And the reason that is because when you become really sick, lacking good nutrition and lacking good electrical charge, the cell membrane actually becomes almost like hardened a little bit. And it's not supposed to be. It's supposed to be able to move and to absorb things, to get rid of toxins and absorb nutrients. So you come in and you're on a nutrition program and your body is finally getting good nutrients and you're taking all these fabulous supplements and you're seeing results. But what's happening is only 70% of the nutrients are getting into the cell because your cell membrane is happy that it's getting nutrition, but it's not quite functioning at its best. So when we add in something like PEMF, it actually forces the cell to open and close very quickly and to absorb nutrients even faster. So in my last office, we saw huge success with combining this with nutritional therapy because you can just take in nutrients so much faster on a cellular level. Another thing about PEMF that I think is really, really cool is that even though we're providing you with a source of energy, your body is doing the work with it. So I may be putting you in the chair, setting the frequency, and yes, the chair is putting that electrical charge into your body, but your body is deciding what to do with it. I have no control over that. So if you've been on the machine and you've tried it, you know that I tell you, like, okay, tell me when you feel it and let me know where you feel it at. And people are like, what do you mean? Like, shouldn't you know where it's going to go? I'm like, I have no idea where it's going to go. That's up to your body because I don't know where that electrical charge needs to be. If you come in and you have a very specific issue, so if you're like, oh, my knee just hurts so bad, we can just do a small attachment on the knee. But even then, I've had people who are like, oh, I only feel it in my jaw. We are treating the knee, but for some reason your body also needs that electricity, that stimulation somewhere else as well. So I think that that's really fascinating and a fabulous way to understand the therapy is yes, we're providing you with the energy, but your body is doing the work. So that's also why if you come to see me for a consultation, I tell you, make sure that you drink water, drink enough water. And the reason is because while you're on there, your body is circulating very quickly, your body is exercising, and it's working really hard. It's trying to uptake as much energy as it can to repair what's needed. And so it's good work, it's sometimes exhausting work. And so sometimes you can be a little bit dehydrated, or the first session or two you might go home and you might really sleep really good because your body is working so hard. All right. So there's actually research dating back, well, I'll get into more of the history, but the research aspect dates back to the 1940s for PEMF therapy. And there were doctors around the world who were becoming fascinated with frequency and magnets for treating different diseases and organs. And there was one doctor, his name was Dr. Burr, and in 1943, he said that organs that emit a lower electrical field, preceding the onset of disease. So an organ would actually become lower in its frequency, and then he would notice within a couple of weeks or months that that organ was diseased and ailing. So he was using this as a tool to actually prevent disease or to help prior to diagnosing a disease. And his research studies are phenomenal. He was mostly in Germany and France, but it is unreal to think that, here we've got, 70 years since then, and we haven't really utilized this technology and this ability and this understanding of how frequency works within the body. So also with the history of magnetic therapy and PMF therapy, way back, if we go to the ancient Egyptians, they were actually using electric eels. So they would, let's say someone was really sick, they'd put you in a bathtub with a bunch of electric eels. Does not sound pleasant, but they would see results from it, right? So they would actually see results and notice that people would become healthier after being exposed to this. The Greeks did similar things where they actually would find magnetic rocks in nature, and then they would make people go and either live near them or do treatments on them where they would lay on them for several days and would actually treat illness. And actually the word magnet comes from a Greek word, which I think is really cool. We also had, back in 2000 BC, the Chinese were using magnetic therapies to help correct health imbalances. The emperor at that time was obsessed with it. That was the only thing he would let his physician do. So there's a ton of documentation about how much he loved magnetic therapy. And then in the early 19th century, there was a huge movement to use and understand magnets and electricity in healing the body. So a lot of times people refer to Tesla as the father of PEMF. His name is becoming a little bit more popular again right now. So he was really one of the big originators in designing and utilizing PEMF in a much more specific way, not just laying on a magnet, but being able to determine what frequencies can actually help the body. So in the 70s and 80s, scientists around the world started to use PEMF for bone growth, repairing bones, and for fractures. Since then, it's actually become FDA approved for these. So in 1979, it became FDA approved for bone fractures, which is crazy because that's 79, and like just recently, people are starting to hear about it. In France, this is like normal to be treated with in the hospital. So you fracture your arm, or you really, really hurt your knee, or you need a meniscus repair, they will have you utilize this first before going through a surgery or anything like more serious. So it is just now gaining more popularity here in the United States, but I think it's pretty cool that the FDA approved it way back in 1979. Since then, it's been FDA approved for several other issues, including bipolar, anxiety, incontinence. I'm trying to remember, it just recently became approved for Parkinson's disease, osteoarthritis, arthritis. It's going through trials right now for Alzheimer's disease. So it's so versatile. Like, it's amazing. And the research for cardiovascular health and the research even like for cancer is really unbelievable. So at this point, just in the past, I think they said the past 5 years, there's been over 2,000 studies done just on PEMF, and those are like legitimate like university studies, not just people who are, you know, exploring with it, which is also like a whole nother realm of information that you can find. So right now, issues that we can address, I know I just named 10, but also includes pain, fatigue, infectious disease, autoimmune disease, immune dysfunction, migraines, fibromyalgia, basically anything relating to the nervous system. It helps increase circulation, so people with neuropathy or who have different issues, it can be very helpful with. Tendinitis, leaky gut, glaucoma, Parkinson's, and so much more. We even have like pretty intensive athletes who want to utilize the machine for recovering. So like LeBron James has this exact model in his house, of course, right? Because then he can utilize it after every game, and it's becoming more popular now where teams are actually buying these and keeping them in the locker room. So that way someone gets injured, okay, yeah, go throw them on so that they can still come back into the game. So it really just has such a full spectrum of uses, which is really cool. Now, another thing I want to talk about is that there are a couple contraindications because we're working with magnets. You cannot have a pacemaker, and you cannot have anything battery operated that's implanted in the body. So no cochlear implants. I know for some really serious pain, they put like a implant in the spine to like help with that. We can't unfortunately treat anyone with those implants built in. We can do like hearing aids and things that can be taken out are no problem. If you have knee replacements, hip replacements, that's all fine. Anything metal, honestly, is no problem. I've done tons of people who have stents in their hearts and hip replacements and knee replacements. That is not an issue at all. I do like to know that beforehand because it can change how intense, like starting off, I'll start a treatment, so make sure you just let me know. But other than that, it's very, very safe. The side effects are very minimal. Oh, the other thing is that you can't be pregnant. And that is actually, like the research, actually, there's no danger to that. It is more just a precaution. So I've had a couple of women who have been on it and then later find out that they're pregnant. It is nothing to be worried about. It is just something that we are protecting ourselves and don't want to put anything at risk in that arena. So, as you guys know, we are running a demo on PEMF at this time. Where you can sign up. I know several of you have tried it already, and we're doing like a 15 to 20 minute session where you can come in and we have a bed or a chair that you can actually get in, and we let you try it out to see what that feels like. I just want to be very clear with all of you guys that the demo is so much fun. I love chatting with you guys, hearing about what's going on, and trying to, to make sure we get the right settings for you. But do not be discouraged if you do a 15-minute session and you leave and you're like, oh, that did nothing for me, because that's not how this works. So just like we talked about in the beginning, like when you come and commit to a program with Dr. Shelley or with Kim for nutrition response testing or chiropractic, it's something that you kind of have to commit to. I'm not saying PEMF is a forever commitment, because it is not. It works very effectively. It's a very powerful machine. But I do need you to commit to a couple of sessions before you make a judgment about it. So I just want to make sure that that's very clear. And the cool thing too is that when you have a session, even if it's a 15-minute session, we are increasing stem cell production and getting a charge into the body regardless if you notice a change or not. And even when you get up and you leave here, it works for that 15-minute session. It works for another hour after you leave, increasing stem cell production. If you do an hour session, it increases it for at least a day, if not 2. If you do 3-hour sessions, 3 weeks in a row, your stem cell production can continue for up to 6 weeks afterwards. So I have had people who are after like the next day of a 3-hour, session or something, there's, oh, okay, like I feel okay, but not great. They'll call me 2 weeks later and they're like, oh my gosh, I feel phenomenal. And that's because your body is still utilizing the charge that we gave it to do its best to repair and help the body. All right, so I'm going to give you just a quick rundown of what it looks like to come in and get a session, just kind of explain to you like what's actually happening. So when you come in, and hopefully you guys can kind of see the chair up here, what we do is we have a bed option in the back so you can lay flat. You can also sit in the chair, and then we have smaller attachments if you have pain or aches in a specific area. Typically when you come in, I always start whole body either on the bed or in the chair. So for example, you come in and you tell me like, oh, I'm just, I'm really fatigued, I'm not sleeping very well. So I would have you start, let's say in the chair, you would sit down. The chair here actually has medical grade magnets built into the entire surface area. Same goes for the bed that you would lay on, and then the attachments, they all have these medical grade, they're actually from NASA, magnets built into them. So you would sit down and I would attach, let's say the chair, I'd plug it into this machine. And this machine I've been trained on. I went to several weekend seminars, and I've been doing research now for about 1.5 years on all the different settings that we can do with this machine. So I would plug it in and I would know, okay, this person, fatigued, not sleeping very well, and I would actually turn it on and set the frequency to be specific for those issues. When I turn it on, I always start at 0 strength so that you can't feel anything. We turn it up very slowly, and then you let me know when you start to feel it in the body, where you're feeling it at, and then we kind of adjust the intensity based on what your sensation is. Typically the sensation is a tapping, a tickling, or a muscle contraction. You've probably seen, if you've seen our Facebook at all, you can crank it up and you can have actual movement like this, but it is not uncomfortable. People are always really amazed, which is why we offer the demo, because it does look sometimes like, oh my gosh, that's a little much, to be moving like that or to have the muscle spasm, but it doesn't feel quite like a muscle spasm. It just feels more like a mild contraction. So that's something to just keep in mind and to definitely come and try it out so you get a better idea of what it feels like in your body. And then what we would do is we'd find the right setting for you, and then we would let you sit for however long we've determined is best for that issue. I typically change the setting at least once for a full treatment, and usually for the demo, because I want you to understand the different settings and what they feel like within the body. So yeah, so it's a pretty cool thing. We're really excited about having it here. And I'm trying to think if there's anything else for you to know. Does anyone have any specific questions about the device or about PEMF in general at this point? I know I probably talked a little fast, but
What is the frequency, the highest it can go?
So that's a great question. So the frequency on this particular machine only goes up to 12. But I have micro frequencies, so it sounds like there's only 12 settings, but I can also do I can do 0.1, 0.125, so I have all those settings between 0 and 12, so I can make it very specific. That's one thing that I do want to say is that some of you come in and you do mention that you have heard of PEMF before. You'll say, oh yeah, I've heard of the Beamer mat or the MagnaWave. They're becoming more popular for at-home PEMF therapies. I think that products like that are wonderful, and I understand their benefit. Here's the thing, something like the Beamer mat that you would have at home, you'd have it on your bed, you have to use that 1 hour to 3 hours every single day for several years to get the same result that you would get from 10 treatments with this. So do I think that that's a problem? Not at all, but I know that a lot of us have time constraints and commitments, and we're trying to heal faster than that. So any PEMF is going to be beneficial to you, but I prefer this machine, and we bought this particular model because it gets results the fastest. It is the most powerful one on the market, and there are differences in quality in terms of PEMF machines, so they're not all created equal, if that makes sense. I have no issue with people using them. I have people who come in for treatment and then go home and will still use their beamer mat, and that is totally fine with me because you are helping the body. But I do believe that like the faster you can get that energy into the cell or into like repair the body, the better. Yeah, if that makes sense.
Now,
Yeah, you're fine.
Does it reach the capillary levels where all the exchange takes place?
Absolutely it does. So this actually, it will get to like a cellular level. It actually will go all the way to the mitochondria, and it increases stem cell production. So like I have some people, like we have a ton of stem cell production that occurs in our hip bones. So sometimes if I'm treating the hips, people will say, oh, that's a little weird. Like they kind of make a face. It's the only part of the body that can be a little bit funky. It doesn't hurt, but it almost feels like static. That's because we are increasing that stem cell production so much, because that's where so much of it takes place, that you can actually feel that sensation, and it can be a little bit strange for some people. Yeah, does that answer the question? Yeah, okay. Is there any other questions? Yes.
The measurement for the Earth is 7.8.
Yes.
But that frequency is measured in what?
In hertz.
Okay, hertz. So.
Yes.
And the machine is able to go up to 12 hertz or so?
That is correct. It can go up to 12 hertz. And I should say the Earth's frequency on average is 7.8. So most people will just say that's what it is. What that really means is that it's really anywhere from 6.5 to like 8.5 or something like that, depending on where you are on the Earth and where the lightning has just been at and different things. But on average, and what most people refer to as like an earthing setting, is a 7.8. So it's one that we use a lot on the machine, but yes, it is measured in hertz. So you're welcome to like look that up and see what that looks like, because something like the Earth emits, let's say 7.8, and then something like our cell phone emits like 1.2 million. So like they're so incomparable in hertz, but that's like the measurement that you use when you're looking at a frequency. Yes.
The advantage to being able to go as high as 12, is there?
There are advantages. I typically don't go too much further past 7.8. I have some specific conditions. So let's say someone comes in with, I'm trying to think, like a Parkinson's patient, or typically it's your more chronically ill patients. You will go a little bit higher, because the higher frequency you go, the faster the pulse is. And sometimes faster is good, and sometimes faster means it doesn't go quite as deep. But for really chronically ill people, typically what happens is that their cells are so depleted from proper electricity and frequency. So we kind of want to ease them into it. So you'll start with a higher frequency. It's kind of fast and shallow almost. So you just want it to kind of start getting in there and like awakening the cells without causing any kind of side effect or spin out or healing crisis, as we would refer to it here. So it is utilized, but I'd say on average, I don't typically go past 7.8, which is the Earth's frequency. Yes. Oh, one thing, Jason made me think this because we talked about it today, because Jason's been doing the P EMF therapy, and we've been going through some of the research together and like what that looks like and all this new information. And I do have my little board up here, which you guys are welcome to look at when we get up. But one thing that's so cool is that there is actually a picture here of someone who had surgery, and they had an infection. They had a knee replacement, horrible infection. And you can actually use PMF therapy to treat infection, because what happens is the electromagnetic frequency goes in and actually disrupts like the cell of a bacteria so that it can't function properly. So I'm trying to remember, you have to look, but I think that it's like 10 days. They went from like full infection to like a perfectly healed knee. And that's all they used. So they didn't try like antibiotics or anything, because they were worried about the antibiotic resistance. But that is something that's really up and coming with the research for it, is like in hospitals for staph infections and all of these things. So just another example of like how powerful and how easy it could be to use a device like this.
That's my question.
Yeah.
At that, in my mind, I'm thinking it would spread the infection.
Sure.
Because it's shooting in and
Sure,
circulating.
increasing circulation, sure.
So how does it not?
Sure, no, that's a really great
The
question.
white, I know the white cells, does it increase white cells?
It sure does. So that's kind of how it works. So her question for those of you on Facebook, we're in that scenario, let's say for an infection or for something going on that is, let's say, infectious to the body, and you get on the machine, and here we are, we're increasing circulation. So wouldn't that be damaging to the body? And the answer is no, because A, we are increasing stem cell production and also white blood cell. We're increasing the health of the blood cells and the actual cells of the body. And then typically most like bacteria, I'm trying to think, virus, there's like a few exceptions, but almost all of them have something called a biofilm. That kind of protects them. So that's how you get antibiotic resistance, right? Is you have this biofilm and it eventually learns like, oh, this antibiotic's coming, like we're good. You can't get through, like we built this wall against you. Well, when it comes to electromagnetic frequency, it's like these little zaps, right? And it actually breaks down those walls. So it can actually break it down and become easier than for our own immune system to kill it. So the machine and the electrofrequency is not doing the killing, it is just breaking down the barriers so that your own body can fight the infection. Yes.
Does it impact the good bacteria like in your intestinal tract?
It does not. So that's a great thing is obviously like with things like antibiotics, if you're utilizing it, it can, right, we know that it harms both the bad and the good bacteria. PEMF is not like that. So the frequency, because our bodies are made to be carrying the good bacteria in us, they have evolved to not be susceptible to electrical charges, right? Because we're being exposed to them all the time from the earth. And so if you utilize something like this, it will break down biofilm to typically the unwanted ones, but it will not damage or harm because your body is doing the work for you. We're just kind of helping it along. It won't damage any of the good bacteria. So that's a good question. Yeah. Yes, Jason.
And your experience, you've been doing this for a while. You treated people with Parkinson's and similar brain disorders. What have you noticed in treating them?
Sure, yeah. So for those of you who couldn't hear, his question was in regards to treating people with different brain disorders and things like Parkinson's. So I have only had, I now have 2 patients. So I had one in my previous practice and one here for Parkinson's. At the previous practice, we had great success with Parkinson's, but he was very early on and came to us pretty immediately after his diagnosis and was very curious and had read about P EMF. So we did do treatments, and we did, I want to say that we did 10-hour-long treatments, and when I left the office there, his symptoms had completely stopped, and he was, at this point, stable and just kind of seeing where it's at. I have not touched base with him in a couple of weeks, but as of now, he's been very stable. We're working on a protocol for another person who's coming in right now with Parkinson's. She's a little bit further along, so we're going to kind of have to adjust the protocol for her. In terms of neurological disorders, it is absolutely amazing. I mean, the fact that it's FDA approved for like bipolar and depression says so much. And typically what happens is physicians will recommend PEMF after they've tried all the drugs, right? So they've tried everything else and they're like, well, this doesn't work, so let's try this. But people respond really well because we're waking up and helping neurons connect in the brain, right? So that's everything in our brain is electrical signaling. So we actually have great success with any kind of issue that's brain related. So we've done some like traumatic brain injuries, we've done, trying to think, different neurological disorders, and I've done so many patients that have really severe anxiety, and all of them respond very, pretty quickly. They notice differences. Yes, tinnitus. We've had a couple people with tinnitus. That is one, tinnitus and Parkinson's, those ones take a much longer commitment, I won't lie, because a lot of times people have had the issue for so long, and there's so much going on in the body, so those are things that we would talk about, and you'd probably have to commit to more like 20 or more treatments, but that's pretty unusual to have to do that many. It's usually half of that, but again, it just depends on the body. And typically when people do treatment, they will do like a program, so we'll do, maybe 3 and see how you feel, and then maybe 12 or something like that, and then after that, if you feel really great, we will do maintenance, which is like once a year. Like it's literally so easy once we get you to a certain point, but again, it just depends on each person's body. Yes.
Is it helpful for people with Alzheimer's or dementia or anything like that?
Absolutely. So I have not seen a ton of research in terms of dementia. There's a lot of research about Alzheimer's. And we have treated several people that were very, again, early on, but noticing symptoms, or people that were starting to notice things like in their elderly parents or issues going on. And we actually have, and I don't have them up here, but there are attachments for the head. There are paddles that you actually wrap. It seems really goofy when you have them on, but we can literally either place them under the head, or like we Velcro them literally around your head. It's like a little helmet, and we are sending the signals into the brain. And it's so cool, again, like with the brain, Alzheimer's has a lot to do with like neurons that can't make the connections anymore, right? So it's like you just can't get that information to where you want it to go. So when you're adding in an electrical charge, which is literally all neurons do all day long, you are speeding up that process and can hopefully help like reconnect those connections. So there are cases that, you know, that people don't have success, but I always wonder and like try to look at how far along were they, how severe were the symptoms, and like what kind of situation, you know, are we looking at? Yeah, all right, you guys did so great. Good questions, and I can tell you were listening, and so wonderful. So if you guys want to schedule your demo, if you haven't already, or if you have any questions for me specifically about the therapy, or want to know more, want to come up and like look at the actual device, or look at my little poster up here, we've got all sorts of visuals. We've got a broken bone, that 9 days, it's a fracture, 9 days, 1 hour a day, completely repaired. We've got the cool picture of the infection and then it being healed. So yeah, so definitely check those out, and make sure you have the PEMF handout, and if there's anything else that you need from me, you just let me know. All right? Mm-hmm. Awesome. Thank you guys. Thanks, Facebook people.